Yeah. So the role of interest groups, in particular the role of the healthcare industry writ broadly, is really interesting in this legislation. In the development of the Affordable Care Act, one of the things that President Obama and the Democrats in Congress who are leading that effort determined is that prior efforts to reform healthcare failed because they didn't adequately involve interest groups. And so one of the first things that happened in the Affordable Care Act was that they reached out to industry. They reached out to the pharmaceutical industry. They were one of the first groups, actually, that came to the table on the Affordable Care Act. They reached out to hospitals. They reached out to physicians. They reached out to the insurance health plan lobby. They reached out to senior citizens and those who represent consumers. So just about every interest group actually had a seat at the table in the development of the Affordable Care Act. And ultimately, all of these interest groups supported that legislation. And today, you see similarly those interest groups still uniting, still saying that they support the law, actually asking Congress to implement it more effectively, not to repeal it. And they have some very specific requests about what they're asking for that could strengthen the law. Today we haven't seen as much influence from those interest groups, except if you consider the failure to get a repeal through the House so far to be a success from those interest groups and from consumers who are active in making their voices heard. They're really trying to influence this process, and it will be interesting to see whether this Congress is listening. Clearly, the Obama administration and the Democrats in Congress writing the law listened very closely, and there are very specific provisions in the Affordable Care Act, for good and for ill, that you can trace back to what the various different interest groups were looking for. Pharmaceutical industry is a prime example where they came to the table and said, you know what, senior citizens are paying what's called a donut hole. They have deductibles for drugs when they get to a certain spending on drug coverage. We'll reduce that. We'll give money back to senior citizens. We'll help fund lower deductibles for seniors. In return, we don't want Medicare to negotiate drug prices. So that came out of these interest group negotiations, very powerful. Many people would say that's a problem because drug prices are what's going up and we need to be able to negotiate it. But you see the role of interest groups in that legislation. Right now, they're sort of united that they don't want it repealed, that they want it to stay in effect. It's really unclear what impact they're having today, but they are united in their efforts to try to keep it in place. I think it's really important to understand, for all of the discussion there's been about the media, the media is actually a tremendous source of information about healthcare reform, the Affordable Care Act. And they are really trying to play a service to consumers and explain it in ways that consumers understand. I was just in Washington last week, and we were meeting with the media who cover healthcare. And I brought with us a bipartisan group from our state legislature, Republicans and Democrats. And to a person, they came away and said how impressed they were with the objectivity of the media and how they just really wanted to get the story right. And there are there's really great work that's being done by particularly a few media outlets to try to help consumers understand what's happening. So I'd strongly recommend people read the mainstream media. The New York Times is doing fabulous coverage of the impact of healthcare reform on consumers. Kaiser Health News is an amazing resource. Kaiser Family Foundation, kff.org, is an amazing resource. They have consumer explainers on their website. Vox, and particularly Sarah Cliff's coverage of healthcare reform, is doing just really great work to try to get to consumers and explain to them what the impact of healthcare reform is on an individual so they can really understand it better. So you can really find great resources there. Our own organization, which is chrt.org, chart.org, we're doing lots of explanations of the impact of all the different, as new proposals come out, what they are and what the impact would be on consumers. So you can go to our website as well. But there are a lot of resources out there. Many of us are trying to gear them to consumers so that they understand these issues. And I really strongly recommend that people follow the mainstream media and read the stories that come out on a daily basis. They're really tremendously useful. Yeah, I think it's really important to understand what a death spiral actually is, because that is a very specific term. It's a term that actuaries use when a market in this case a health insurance market, becomes unsustainable. And in a health insurance market, when it becomes unsustainable, you have a situation where you have predominantly sick people in the market. So, the way health insurance works, and this is a fundamental principle of health insurance, the way health insurance works is that healthy people subsidize sick people, right? The idea behind health insurance is that we all get sick at some time, but we don't all get sick at the same time. And so if we all pay a little bit, then we can cover the people who are sick, and then when we're sick, we can use those funds to cover us. Right? And that is the whole idea. It is a cross-subsidization. It's share the risk and pool the cost. Right? And so when people say, well, why am I paying for maternity coverage? I'm not going to have a baby. That is the whole principle behind health insurance, right? I'm not going to have prostate cancer. And so, but I'm paying in for people who do have prostate cancer because we're sharing the risk and pooling the costs. That's the way we keep health insurance affordable. Health insurance becomes unaffordable when you don't have that cross-subsidization, when essentially you're only covering the sick people. Then we're just paying for the care of sick people and the cost of the care for the sick people, right? That's what it means to be in a death spiral, when you can't keep the rates, the premiums, up with the actual cost of expenditures that are happening. And what we know is that the Affordable Care Act was not in a death spiral. The American Academy of Actuaries has come out very clearly to say it was not in a death spiral. The Congressional Budget Office said it was not in a death spiral. Yes, there are some parts of the country where there are few choices and where premiums are high, but that in and of itself is not a death spiral. That says we need to intervene in those particular situations. Actually, the market was stabilizing before this latest discussion about repeal and replace. Now, when we talk about could it explode, first of all, we need to understand that what we're talking about is the individual market. It's the market where people buy health insurance themselves. It's about 5% of the U.S. population who buys health insurance for themselves. Most of us still get our coverage through our workplace, through our employer, or through the government with Medicare and Medicaid. So we're focused, when we talk about exploding, on this population that buys coverage in the individual market. And again, the market was stabilizing. However, there are some issues right now that are being debated in Congress and with this administration that are making health plans extremely anxious about what the future is going to hold. In fact, they have no clarity about what the future is going to hold. There are some specific funds that were due to be paid to health insurers that Congress and the administration are withholding right now and not giving clear signals to the health plans whether they will pay those funds. Those are called cost-sharing subsidies, and if they are not paid, the lack of that payment will raise premiums in and of itself by 20%. Now, if those are paid, that gives stability to the health insurers. Health insurers right now are deciding whether they're going to be in the marketplace in 2018. And many of them are saying, it's too uncertain. We don't know what federal policy is. We are going to withdraw. We've already heard Humana said they're going to withdraw. Aetna said that they're going to withdraw from many marketplaces. And many more health plans are likely to pull back unless they get clarity and know what the rules of the game are. The rules aren't clear right now. And that is the thing that health plans can't deal with. They cannot deal with this lack of certainty. So I am concerned that this fall, we may see many parts of the country where there are very few, if no choices of health plans in this individual market, and premiums will be very high. Now, the federal government will end up paying more because of the tax credits in the Affordable Care Act, assuming those aren't repealed. So people may not pay as much for those high premiums. It'll cost the federal government more, but they may not have a lot of choices. And I really am concerned about that. It's essential that health plans get clarity and certainty as soon as possible so they know what the market is that they're working in.